This is a presentation regarding a client who, for confidentiality purposes, we will refer to as PF. And this is a case study of autism spectrum disorder in an adult client at the Westchester Institute for Human Development. A bit of background information on this particular client. He is a 28-year-old male residing in White Plains, New York, with his mother, father, and brother all living in his household. Additionally, his immediate family includes his mother, father, two sisters, and one brother who is younger than him and also has autism spectrum disorder. He attended school until he was 21 years old and is cared for primarily by his mother and a caregiver that comes 2 times a week to bring PF into their community. When he goes out, he enjoys to go to the bottle recycling return. They also bring him out to the grocery store and the laundromat a lot, so they really want to have him be able to communicate a bit better. So when they bring him out into the community for safety purposes and interacting with strangers, he'll be better understood. Here we have a bit about PF's diagnoses and his current communication abilities. Early on in life, he was diagnosed with autism spectrum disorder and is currently being treated at WIHD, targeting mixed receptive expressive language disorder and unspecified intellectual disabilities. He communicates through gestures, limited verbal output. This can include some grunts, other nonverbal communication methods, and emerging skills on his speech generating device, which him and his brother just began using. His mom was able to get access to them for both of her sons, so they're really learning to master their speech generating devices. He is assisted by his mother during all of our sessions, and his mom uses prompt tactile stimulation when we're working on those multisyllabic words with him and his speech intelligibility. And his mom is very helpful having her in the session because it is over teletherapy, which can be difficult, especially in moments of frustration. His mom is really good about helping calm him down because there's only so much we can do through the screen, so she's very helpful in those cases. And his nonverbal communication is typically used during times of frustration. So this is when we might get more of the grunting or gestures or other body movements, just expressing that frustration. Speech and language therapy history. PF received speech and language therapy in school until age 21. He began attending the Westchester Institute for Human Development, WIHD, in 2018. In this time, there was a lapse of a few years. I started seeing him at WIHD at age 28, and he stopped receiving therapy at age 21 from school. So there was a few years lapse in his speech and language therapy. He began attending, as I said, in 2018, and then stopped attending once the COVID-19 pandemic began in 2020. Prior to that, he was coming into the clinic on a biweekly basis. And so once COVID-19 happened, he had stopped attending, but began attending again via teletherapy in January 2021. This is some background on autism spectrum disorder. It is one of the most common neurodevelopmental disorders, and it has defining characteristics within 2 areas: social communication and restricted and repetitive behaviors. In PF's case, we did see defining characteristics within both of these areas. So social communication, his expressive and his receptive language was impaired, and as far as restrictive and repetitive behaviors, his mother reported he would sweep the house often, vacuum often, sometimes over and over again. He also had nonverbal communication deficits. These included poor eye contact and understanding facial expressions and gestures, and these were things that we really wanted to target with him in therapy. He also had varying degrees of verbal communication deficits, which is typical in autism spectrum disorder. So having those varying degrees, such as delays, monotonous speech, echolalia, pronoun reversal, poor comprehension, or total lack of verbal output. In PF's case, because of the limited verbal output, we did not notice any monotonous speech, echolalia, or pronoun reversal. This is some information on mixed expressive receptive language disorder, something that we're working on with PF at WIHD. And in mixed expressive receptive language disorder, expressive language is delayed or impaired, and receptive language deficits tend to lend difficulties decoding on the sound, word, sentence, and the text level. Language skills among those with autism spectrum disorder varies greatly. There is a higher incidence of behavioral and social problems seen in those with mixed language disorders, which we do see in PF's case. He does often have some behavior problems that were noted in our session as well as reported by his mother. These typically are noted when he can't express his wants and needs. There are 4 long-term goals we are targeting in PF's speech and language therapy. The first is that PF will improve functional communication across communicative contexts. The second is that PF will improve receptive language skills. Next, we have that PF will improve expressive language skills. And fourth and finally, we have PF will improve speech intelligibility. Here we have the short-term goals that were targeted in therapy with PF. It may seem like a lot of short-term goals, but there was in fact a lot of overlap when we were administering any therapy strategies that we used with him. So the first one we have here is PF will label parts of the body with 70% accuracy and moderate verbal cues. Then we have PF will use his speech-generating device with 60% accuracy to identify and express pain with moderate cues. PF will verbally express function of presented objects with 70% accuracy and minimum cues. PF will express wants and needs using 3 to 4 word utterances with 60% accuracy and moderate cues. PF will identify actions with 60% accuracy and minimum cues. PF will verbally express emotions with 70% accuracy and moderate cues. Finally, we have PF will improve intelligibility of multisyllabic words with 70% accuracy and moderate cues. Therapy approaches. One of the things we worked on pretty much every session with PF was identifying emotions: sad, angry, happy. So to target this, we might put up a picture of someone expressing one of those emotions and ask him which emotion is being expressed. Or we would also ask him to identify his own emotions depending on how he was feeling that day. Particularly during times of frustration, it helped us to kind of differentiate if he was sad or if he was angry, and having him express those and give name to them. We focused a lot on incorporation of his speech-generating device. This was a very large goal, or one that his mom really wanted to target. So we made sure that most of the session took place on his speech-generating device. We also worked with him to describe object functions, emotions, and work on production of multisyllabic words. As I stated earlier, his mother was there during the sessions using prompt stimulations when he was producing those multisyllabic words in an attempt to have him produce them more intelligibly. The biggest focus of PF's therapy was to focus on functional communication with and without his speech-generating device. So expanding on his utterance length, asking safety questions was a big one, just because he is going into his community, and if he were to get lost, being able to answer questions such as parents' names, address, phone numbers, etc. We also focused on asking health questions such as what hurts, do you need medicine? So there were a few instances within our sessions where he was able to say that he had a headache and he did need medicine. So his mom was able to get him medicine and really reduce the amount of time that he was in pain. So that was super helpful, and she said he has used that outside of therapy as well. We also worked on answering yes/no questions together. So are the goals appropriate? Yes, the goals worked on in therapy really focused on functional communication, which in PF's case was the primary target. Due to his limited expressive communication, working on functional communication allowed PF more ways to communicate his wants and needs, and making it easier for caregivers to help. This was something that was very important to PF and his family, was that he could communicate his wants and needs and take part in more functional communication exchanges more beneficially for himself and for those around him, so that they could meet his wants and needs sooner. This is a bit on PF's performance in therapy and recommendations that we provided to him and his family. As far as performance, it was inconsistent on new material, but successful on routine questions. So he began to be very, very competent in answering his personal questions, such as his parents' names, his address, his phone numbers, which was very important and something that his mother really stressed working on. So he was able to do that. On newer questions, he did have a bit more trouble. He was easily distracted over teletherapy, which could often hinder the sessions a bit. And he began using his speech generating device to answer spontaneous questions outside of therapy, and that was reported by his mother. So that's what we really want to see, that generalizing of skills outside of our therapy sessions. The recommendations that we provided were to continue speech and language therapy, and especially because he was still new to his speech generating device, not letting the time lapse in between his sessions. As we know, after he completed school at 21, there was a few years lapse before he was back in speech and language therapy. So we really recommended that they don't let this lapse happen, especially while he's still learning on his speech generating device. We also recommended to come into the clinic for in-person sessions. This would benefit both PF and the clinician in that it would reduce moments of distraction for him, but it would also give the SLP a little bit more exposure to him during those moments of frustration and helping him to express those emotions, maybe using his speech generating device or verbally, but being there to help him express that. And here we just have some references that were used throughout the presentation.